Jay Pendleton, MedTech Voice. I'm here for 5 good minutes with Dr. Ahilan Sivaganesan, or Siva.
That's right.
Great to be here.
See you. Yeah.
Thanks for joining us.
Absolutely.
What I'd like to do is just get to know you a little bit more here, but really for the audience and for what this ends up being, it's just like there are so many moving parts to medicine, to practice. There's private practice, there's academic, there's insurance, social media, patients. You got a lot of different ways to treat the same pathology.
There's an anecdote that I think maybe summarizes sort of where my passion comes from. And there's this book by Tracy Kidder called The Soul of the New Machine that came out in the 1980s. And it's basically about, there was this dominant mini computer company called DEC, Digital Equipment Corporation.
Okay.
And they had come out with this really great product. And the competing company's engineer was like, I have to see this thing. I've got to break it open and get a feel for it because this is the competition. So he secretly goes into the main company's warehouse.
Wow.
And breaks open this thing. And this is the moment that relates to healthcare, is that he's looking at the circuit board for this mini computer from the 1980s, and he's staring at it. And there's like 27 different components and all these little connections. And he's staring at it and he mutters to himself, like, this is too complicated. And then he's staring at it and he realizes that in the design of the circuit board, he can see a schematic of the organizational chart of the company.
Wow.
Okay, so he can see that each division designed that component, this division designed this component. They were optimizing for their own little component.
Wow.
And then all the connections are awkward now, and the connections between the components reflect the actual communication lines between the divisions in the company. So it was a profound thing where he could see the organizational design of the company in the design of the circuit board.
That's brilliant.
Right? So I was reading this, and it's a passage in The Innovator's Dilemma, which Shiraz talked about in his presidential address. And I realized this is also an amazing analogy for healthcare, right? As a surgeon, I have my little space. I'm trying to optimize my practice, do as many surgeries as I can, as many high-paying surgeries as I can. The next person over is the physiatrist. They're trying to see as many physiatry patients as possible. The pain doc's trying to do as many injections or interventions as possible. And we're not necessarily talking to each other. You're not even incentivized to talk to each other. And so the patient's journey for the spine condition can feel a lot like the crazy. labyrinth of this circuit board.
Wow.
And so so the analogy I give too, it's like if you ever go abroad and you're at one of these sort of street markets, and you're walking through, and every booth, it's like, hey, you want some of these coconuts?
Yes.
Or hey, you want some of these little craft pieces?
Sure.
That's what it feels like for a patient, right? Every stop in the journey is a specialist trying to peddle their goods.
As a caregiver to my dad, we went through what you're describing.
Yeah.
The run around, getting bounced around, infectious disease, spine, pain management, and really having zero peace of mind and no answers.
Yeah.
And it's hard.
Yeah.
What are we doing?
But that's the other analogy I think that we've chatted about a little bit, which is this idea of you're hacking your way through a jungle, and you got a team of guys, and you got machetes, and most of what spine research and R&D and meetings are about is making a better machete.
A better machete.
How do we sharpen this machete? How do we change the handle? How do we train, the techniques on how we use the machete, right? And then that's great, we need to do that. But some people need to climb up the trees above the canopy, look ahead and say, are we even in the right jungle to start with, right? That kind of zoomed out bird's eye view of the entire care journey is something that, like, if we as surgeons don't think about that stuff, either nobody will, I think, or people that don't understand the field will do it for us, and patients aren't going to benefit, and we're not going to benefit.
Well, and it speaks to why I'm sitting in this chair, because I feel almost called in a way to help tell some stories, micro stories, behind the scenes, because I know the space, at least from the industry side, at least from standing in rooms with people like you.
Thanks for the opportunity, and I think we should broaden the aperture of what spine innovation can look like. And while we continue sort of procedural and technical innovation on the sort of medical science side, there's also innovation that needs to happen on the healthcare delivery side, and that's a science in and of itself.
Yes, it is.
And I think a lot of patients will benefit from that level of innovation as well, and I think it's important for surgeons to be in the driver's seat of that, and so I hope I can contribute a little bit to that.
Really, just thank you for the time today.
Yeah, no, thank you, Jay. Yeah, it's great. Keep it up.